You're still live here on your Feel Good Breakfast Show on S3. It's time for our Health Tuesdays conversation. It's all about pregnancy. Now, pregnancy is no doubt one of the most thrilling and worrisome times in a woman's life. Finding out you're pregnant can raise a lot of questions, anything from what you should eat to can you exercise and how much weight will you gain. All of these questions are perfectly normal as you embark on this new journey to motherhood. I feel like it was just
And the guy doesn't have the answers. The guy doesn't have the answers, so we bring in the experts. That's why. And as we look to strengthen pregnancy education and stress important issues to promote healthy pregnancies this Women's Month, I think all year round, but vital importance right now while we have this platform for additional awareness. And we've got medical doctor turned entrepreneur, Dr. Matobela Machakane is here to discuss staying safe and healthy during pregnancy. Doc, welcome to it.
Thank you so much.
I feel like as a guy, okay, I can't speak with authority in this space, but I have had 2 kids. So I've had a front row seat, as I said at the beginning of the show, and it is the most wondrous time. It's just, I stood back in awe watching what is going on, but there are so many questions that come up during this period. So maybe a good place to start is when you need to lean on a professional. How often should you be seeing your OBGYN? How often should you connect with a professional in that space?
Okay, so most women would start by missing their first period, so they wouldn't see the period that they would normally see. And that's when the alarm bells go on to say, hang on, there might be something wrong with me or something, it's not normal. And then that's when we would encourage them to go and make contact with their obs-and-gynae or their general practitioner just for them to give them a diagnosis of their pregnancy. And from there, they would need to see a medical professional at least once a month for the first 7 months, and then the last month, that's when they need to go to the gynae at least every week before they deliver their baby.
Your gynae kind of guides you through that.
Yes.
You form a very close relationship with your gynae.
Definitely. I think a question that so many expecting moms want to know right now is, can pregnant moms get the vaccination? Is it safe for the mom? Is it safe for the baby? Maybe you can answer them and put their mind at ease.
Currently, because of the time period that the vaccine has been developed and everything, so the scientific research is still continuing, but the recommendation from the WHO is that we have to look at the risk versus everything. So if a woman is basically a frontline worker or they've got other comorbidities, they are mostly encouraged to get the vaccinations. Other than that, we are still encouraging mothers to get the vaccination because the risk of getting COVID while you're pregnant, it's far much devastating than not getting a vaccine. So we are still encouraging them, but we're still saying that, yes, there's not enough research to say what are the long-term effects that are gonna be on the baby, but the benefits are there for you as a mom to get the vaccine.
Because what we do know are the risks of COVID,
yes.
especially if there's a pre-existing comorbidity, as you pointed out. So let's talk about the broader sense, because it's a big shift and a change, and so much happens, again, something that just amazed me instinctively, that a woman who's pregnant just knows what she needs to do in a lot of essences, but there have to be some clear lifestyle changes. So what do you need to start thinking about and look at in terms of those key lifestyle pressure points when falling pregnant?
Obviously, the most important thing is also patients that are on chronic medication, from your anticonvulsant medication to anything, they need to see the healthcare professional, because sometimes when you're pregnant, you've got so much water overload, and those medications might need to be adjusted to make sure that you are having the right therapeutic ranges. From a point of view of diet, it's very important to make sure that you are eating a well-balanced diet, and exercising is still highly recommended. Obviously, you shouldn't push yourself to the limit.
You learn your limits, yeah.
Yeah, so it's very important to be holistic in everything as you're going through the journey of your pregnancy.
No alcohol.
Yes, no alcohol. Also, smoking, it's not advised at all because of the risk of vasoconstrictions that it may have on the baby, meaning that there'll be less oxygen going from the mom to the baby, and that can affect the developmental stages of the baby.
What are normal side effects when it comes to being pregnant, and when should you worry when, things are feeling not okay?
Okay, there's something called morning sickness that most women will experience. That is a normal side effect of pregnancy. However, when you start vomiting all the time and nothing stays in and you're getting weak and dehydrated, there's a condition called Hypermesis Cavitarum. That's when you should go and seek medical attention, because in those cases you might find that we even have to admit the patient and put them on a drip just to rehydrate them. Some of the other side effects would be a bit of constipation, too much saliva. Some women would experience that, and so they've got a high sense of smell. You find that some perfumes, they smell horrible.
Maybe
just don't enjoy the smell anymore. And hemorrhoids. Some women might suffer from hemorrhoids, bloating, acid reflux. So there's quite a lot of things that
It's tough out there, girl. It's tough out there.
It's tough. By the time the baby comes, the woman will...
You'll be so happy.
Yeah.
You'll be like, thank you, I'm done for 9 months.
You certainly learn a lot about yourself through this process, but it is, as I said, it's miraculous to watch the process unfold before you. But I know for women who are right in the middle of it right now, it can be a very confusing time. So we're going to hopefully continue to tick those boxes, answer those questions. We're going to focus on nutrition in our next discussion.
It's my feel-good breakfast show.
Welcome back, you beautiful souls. We're continuing our conversation. It's Health Tuesday, and we're serving up so much goodness for you today, of course. And the conversation that we're carrying on with this morning is the one where we're joined by our registered dietitian, Karina Adams, and she's going to be talking about and taking us through how to eat well during the pregnancy period. Karina, it's so good to have you. How are you doing?
I'm well, and yourself?
So good. I'm learning so much. Gee,
Yeah, look, I kind of feel like I've been through a lot of this before, but it's all stuff that is so vitally important, because you really are. You've got to think about yourself and baby, and very often we'll think about baby, but you forget about the pregnant mom, that she still needs the energy, she needs the nutrients, she's creating a miracle inside her. She needs to be able to look after herself as well. Food becomes vital, absolutely. We know that there is obviously a huge amount of supplementation that goes with it for certain key things, but you've got to look to your whole food to get what your body needs and what Baba needs. So what do we need to be including in our diet if we look at a general sense when pregnant?
So it will apply like a general population, but obviously it's more crucial now because you're feeding yourself and you're feeding baby. So it's very important that your fresh fruits and vegetables makes a bulk important part of your diet, because that's how you're going to prevent yourself from getting deficiencies. Because if you get a deficiency, a baby basically doesn't get enough nutrients. So it's not just about feeding yourself, it's about feeding baby. Making sure quality proteins are in your diet, and that obviously is fresh chicken, fresh meat, but also looking at your beans, your lentils, chickpeas, like those things that are whole to be in your diet. And then obviously good carbs. We still need carbs. Carbs is not the bad guy. You still need good quality carbs, and that means things like butternut, carrots, pumpkins, squash, whole foods. Every time we speak about food, it needs to be in its whole, most precious form, because that's how packed it will be with nutrients. Once it goes through a machine, it's processed. So you really just want that whole goodness when you are pregnant, and making sure that you have a variety of everything.
With peanut butter on it.
With peanut butter on it.
From what we saw during our craving, that seems to be 99.9%. Yeah, peanut butter with anything, basically. Baby powder even. No, please don't eat that. Please don't eat that.
I would imagine, obviously, and you're speaking about all the good stuff that I think anybody can adopt when it comes to a good diet. Good fat, good carbs, good protein, all the stuff that we actually need. But I mean, when we're talking about these crazy cravings that come through, is there anything that we should really look at avoiding, and foods that are a definite no-no when it comes to pregnancy?
Oof, definitely. So for the sushi lovers out there, that is a big no-no.
You're making a lot of people out there
Sorry.
upset right now.
I'm so sorry. And Lynn's, she loves sushi, so it was tough. It was tough.
Biltong is a no-no as well. Even anything smoked is no-no, because anything that's not been cooked to a proper state can have bacteria. So you can either get a bacterial infection like salmonella or listeriosis, but that can basically impact yourself and your pregnancy. So you can actually miscarriage or have a stillborn.
serious business, yeah.
It's serious. You don't want to play with those things. So, and then obviously salty things, very, very salty things pushes up women's blood pressure during pregnancy, which can put her in a state of what we call, if she continues to eat like that, preeclampsia, which is highly, highly dangerous, which is not just dangerous for the baby, but for her own health.
Sure.
So when it comes to pregnancy and you're telling a mom that loves sushi to avoid it, it's really difficult for them. It's tough.
That's why the first meal you have when you have the opportunity is generally sushi with a glass of wine. That's just how it works out. So you are eating for two, but you aren't, as a rule, eating twice the amount. How much should you be eating while pregnant?
So you eat your standard energy, so you do what you've usually been doing. And when we speak about this extra energy, it literally equates to 2 slices of bread with extra bit of cheese and avo. That is
And
it.
peanut butter.
And peanut butter. So it's not a double meal. So we literally say the extra calories that you need is minuscule compared to what females are. I'm eating for 2. Because when you're eating 2 plates, you're adding to excessive weight gain during pregnancy, which means post-pregnancy, it's difficult to shake that off.
And that has a very, very powerful mental and emotional
Naturally.
effect, yeah.
Because it can lead to postpartum depression, because now I'm not losing enough weight for my baby, or I'm not losing, my self-esteem goes down. So it's literally, like I said, if you can just squeeze in an extra 2 slices of bread, cheese and avo, if that's your late night snack or just in between extra, but not a double plate, because that really adds to excessive weight gain.
Now, so I imagine obviously not eating too much food is not necessary, obviously, but I would imagine that the type of food and the quality of your food is important, especially when you're talking about the minerals, the vitamin value, etc. So if you're not getting that in your actual meal, is it going to help by incorporating or including that into your diet, some supplementation, multivitamins,
Surely
etc.?
you've got to, yeah.
So when it comes to pregnancy, the first vitamin that is highly, highly important, we look at something like folic acid. So folic acid is the one nutrient that they've identified that prevents a neural tube defect called spina bifida. And that's why it's very important for South African women to note, go make your booking an appointment. If you can't afford medical aid, go to the government hospital, because they can provide that supplementation for you. But when it comes to multivitamin supplementation, it's important that you discuss it with a health practitioner. Because what happens if you take the wrong multivitamin supplement and there's too many vitamins in it that can be toxic for your body, it becomes dangerous. Things like vitamin A, which is a fat-soluble vitamin, it's good for your body. When you're getting it out of food, it's very good. But during pregnancy, vitamin A can be damaging if you take too much of it, because it's toxic. It can't really be excreted from the body like a water-soluble vitamin. So it's very important that you discuss your multivitamin with your healthcare practitioner, whether it be a dietitian or a doctor, to go with your diet. Because if you're getting enough from your diet, it's not necessary that you have to go to a multivitamin, because then you might be pushing the boundaries and causing toxic levels for your body.
All right, but the Pregivits, the way to go.
Yes.
We're going to continue this discussion in just a moment. Stay tuned, because our panel is going to be answering your questions. Hopefully you guys have been online. You've let us know on our Expresso Morning Show Facebook page if you've got any questions relating to pregnancy, nutrition, or on the medical side. We've got 2 experts in the house to answer that. And of course, through this pregnancy journey, you will become really good friends, as we have, with your gynecologist. And we're going to lean on a gynecologist right now to discuss the MENA Cup at depth and find out a little bit more.
It's my feel-good breakfast show.
We are continuing through the amazing, the wonderful, the miraculous journey that is pregnancy, and the boys are learning a little thing or two this morning. Ultimately, we want to hopefully give you some tips on navigating this very crazy time, and obviously a wonderful time of your life. And we've got our panel now sitting before us. We've got Dr. Matobelo Machikane and Karina Adams. They'll be answering any of your questions. If you want to get online right now, get onto our Facebook page, fire away. This does become quite a self-indulgent thing, because I've been through 2 pregnancies. I've been present to watch the wonder unfold, and there were a couple of kind of trigger points that really did come up, and one of them, and I think this will certainly hit the mark with a lot of women who are going through morning sickness at the moment. Is there a dietary approach to helping, and we can maybe put this to both of you, what the best ways to handle morning sickness are? Can you change your diet to help?
You can, like, especially in the morning. So when you wake up, your body's cortisol levels are still very high. So that can also link to nausea. So what we usually say is your first morning breakfast, it shouldn't be something fatty. So when you're eating something like in the morning, don't go for like eggs or something. Usually start with something like dry toast, no butter. You can maybe do slightly a little bit of jam, or what you can do is you take a cup of tea and ginger biscuits. Ginger biscuits can save...
For the win, yeah.
For the morning sickness, but not raw ginger itself, because that can be quite dangerous. But buying ginger biscuits, that's trying, obviously, the gluten-free option, but having that with a bit of tea as your morning breakfast, then going for scrambled eggs, bacon, because obviously there's things that you crave, but the moment you start to eat them or smell them, you become nauseous. So limiting how much fat you have in one meal is important. Rather spreading your fats out equally, than having it all on your plate, because that can really link to nausea, because also it fills up the stomach, so the food stays too long here.
Okay.
So try and getting simpler things to eat. But as I used to say, dry toast, things like Provitas, snacking on Provitas, a little bit of cheese.
So you're still getting a bit of nutrients and a bit of roughage,
yes.
and you know, okay. Just gets better and better. Dry toast, that's all you got. I'm sorry.
Oh, look, we obviously posed this question to you, Mzansi, and you've come through with some great questions. Obviously, with this beautiful panel that we have, we thought, let's not put it to waste. And we asked you to send some questions in, and of course, you came through. And we're starting off with, it looks like, I can't actually make out that name. Kato Kumar is asking, is it normal to vomit every day? Every time I eat something, I'm vomiting, and I'm even afraid to eat. So again, seems like it tends towards the morning sickness, but maybe, of course, our panel has something to say about it.
Doctor, is that normal morning sickness? How long should it last? When does it become a reason to go and seek professional help?
Yes, it can be a normal phenomenon that, you know, some people would vomit every day. However, it's usually limited to the first trimester. After that, you know, you need to start making sure that there's nothing else underlying that is causing her to have that continuous vomiting. And again, it shouldn't be the whole day. It shouldn't be like everything that they're eating, they're vomiting.
And of course, because you still need the nutrients, you need to stay hydrated. So if it's getting to that point that you are becoming dehydrated, then you need to see your doctor.
Yes.
Well, don't worry, there's more questions coming through. We are definitely going to be putting you up to the test. And another one coming through this morning asking, is it normal for my baby to kick non-stop during the trimester? Is that the normal case?
When should a baby start kicking? When does that happen, and what's normal?
Most of if it's your first time you're pregnant, most people will start feeling fetal movements around 20 to 21 weeks. And then the more babies you have, you might start feeling a bit of shake a little bit around 18 weeks or so.
So 18 weeks is when they come alive.
My favourite, I would literally put the remote on her belly and then it would get like kicked off, man. The party tricks are amazing. Maybe we can round off with some advice. From a nutritional perspective, what would you say is the most key element to bear in mind if you're pregnant?
I think the key element for me is, and this is where I like to venture into, make your partner part of your decisions. If you've got a partner, make them part of your process, of your journey, allowing them to say, look, I'm craving this today, but do understand that it's a process. And if you're doing this on your own, you know what, all I want to say is you're doing a good job. You're doing a great job. If you're eating healthy, you're hydrating well, you're taking care of yourself, because taking care of me means I'm taking care of baby. So my big advice is really make your family and your support system part of your journey. Don't do this alone, because you're going to feel stuck and become depressed during your pregnancy.
Yeah, and I can speak from the perspective of the guy. There is so much that you can't do during this process. So the more you can feel involved, the better. And then you go into your beautiful little baby bubble, and it doesn't matter how difficult or crazy that journey has been, you are then rewarded with the most amazing new gift. And that is just probably one of the most precious things that you can experience. So if you are pregnant right now, congratulations. Hopefully you've gleaned a little something that helps you from our beautiful panel.